What do you call a happy cowboy? A jolly rancher. Hi everyone, thanks for joining me today in the vet truck. My name is Dr. Witzel with Western Montana Equine. Dawn asked a question about gastric ulcers in horses, and so that's what our topic is going to be today. A while back I wrote an article on gastric ulcers in horses and posted it to our website westernmontanaequine.com. Feel free to look that up if you'd like a little bit more information. So starting out with what to look out for, there's a pretty wide range of clinical signs that would indicate ulcers in horses. In severe cases, you would have horses that don't want to eat or maybe even be colicking, whereas in mild to moderate ulcers, you may only see a behavior change, grumpy attitude, splashing in the water, poor performance, being cinchy when you saddle the horse up. They may be unwilling to perform a task that has never really been a problem for them before, or they may be grinding their teeth out of pain. So considering how mild these clinical signs are, it'd be pretty easy to overlook them and think that your horse doesn't actually have the problem that's currently inflicting him. So I think the big question that everybody's trying to ask is what would cause stomach ulcers in horses? And it's a little bit more in depth than most people expect it to be. In order for you to understand why horses are more susceptible to stomach ulcers than other animals, it's important for you to know what sets their stomachs apart. Horses were designed to graze all day long, keeping their stomachs relatively full of feed material throughout the day. Because of this, they produce stomach acid 24 hours a day. Grazing will also increase the saliva production that the horse makes, and saliva is a buffer for the acid that the stomach produces. So in the horse's natural environment, they're grazing all day long, and the food and saliva is buffering that acid production. In captivity, horses are very often fed 2 big meals a day, and this allows the stomach to sit relatively empty for a large portion of the day. There's nothing to buffer the stomach acid, and that stomach acid will eat away at the lining of the stomach. Something else that sets horse stomachs apart from other animals is that they are lined with 2 different types of mucosa. They have glandular mucosa and non-glandular squamous mucosa. The glandular portion of the stomach is the lower part where the acid all pools, and it produces a film that protects the lining against the acid. However, if the stomach sits empty long enough, that mucus layer is ineffective at protecting against the stomach acid. Ulceration of this lower part of the stomach is called equine glandular gastric disease. The squamous or non-glandular epithelium lines the upper half of the stomach and has no natural barriers or protection against stomach acid. So if a horse is exercised on a relatively empty stomach and the acid splashes up onto this mucosa, it's very easy to be damaged. Ulceration in this region of the stomach is called equine squamous gastric disease. Next, I want to talk about what may be increasing the risk of your horses developing stomach ulcers. As most of you know, anything that increases stress in animals is going to increase the acid production and thereby increase your risk of developing stomach ulcers. This can happen in horses that are naturally more nervous or excitable than others, horses that are in training or are boarded at a high traffic facility, and horses that travel frequently to shows or competitions. I want you to understand why this is stressful for a horse. If a horse is comfortable and used to living in a certain stall or paddock or around certain other horses, and then you up and take him away, he doesn't know that he's only going to be gone for a day or a weekend or a week. All that he knows is that he may never see his best friends or his favorite food bowl again. And as silly as that may sound, it can cause a fair amount of stress to the horse. Other risk factors could include certain management or feeding choices, like high concentrate feeds or high sugar feeds that can increase the acid production. Exercising on an empty stomach can also cause that acid to splash around up into the squamous mucosa and cause damage. So how do we know for sure that your horse has stomach ulcers? And what's more, where they are or how bad they are. It's so important to have those pieces of information available in order to properly and effectively treat and prevent those ulcers from occurring again. And the only way to find out this information is through a gastroscopic exam. This involves passing a long endoscope down the nose, through the esophagus, and into the stomach. In order to accomplish this task, your horse is going to need to have a completely empty stomach, so that the vet can look not only at the upper squamous part of the stomach, but also the lower glandular stomach, and even go into the duodenum, which is the first section of small intestines that the stomach empties into. So after scoping your horse and determining whether it has equine glandular gastric disease or equine squamous gastric disease, or both, your vet can then make a recommendation as to a treatment. And treatments usually involve a combination of medications and supplements. The medications that we use most often are going to be omeprazole, sucralfate, ranitidine, and misoprostol. The supplements that we may end up using are going to be a form of antacid. Unfortunately, in horses, antacids only work for about an hour. I've also had some luck with the soothing effect of aloe vera juice. So apart from supplements and medications, there's some management strategies that can be incredibly effective. Minimize your horse's stress level by reducing travel and changing stable mates as infrequently as possible. Increase meal frequency. This can be accomplished by the use of pasture time or splitting meals up into smaller, frequent meals. A slow feeder can be a very effective tool at accomplishing this. Avoid exercising your horse on an empty stomach, which will allow the stomach acid to splash up onto the squamous mucosa, causing ulceration. Feed adequate amounts of roughage or hay to buffer the acid and reduce the amount of high concentrate or high carbohydrate feeds. And if your horse has a habit of cribbing, try your best to prevent that if at all possible. Cribbing allows for a longer duration of an empty stomach and increases the risk of ulceration. So in closing, pay attention to the warning signs that your horse is giving you and get him checked out sooner rather than later. It's always easier and less expensive to treat ulcers in their earlier stages. So that's all I have today on equine stomach ulcers. Thanks for joining me in the vet truck. I hope I was able to teach you something worthwhile. If you enjoyed this video, please hit like and subscribe to the channel. And please leave your questions or topic ideas in the comment section below. Have a great day. So that's all that man, that's bright.